had a young teenage patient who came in severe abdominal pain, severe lower abdominal pain, and tested positive for chlamydia, and I was concerned for something called pelvic inflammatory disease. So I consulted gynecology to come and see her to help us do a full evaluation and confirm the diagnosis. She was crying, she was screaming, and she was in a lot of pain. This gynecologist comes in, he examines her, and he tells her, this is what happens when you have sex without a condom. No empathy, nothing. And just tells her to stop crying, she needs to be strong, and this is what happens when you do things like this. Then, to top it all off, I go back to my office. He comes to my door, and he says this to me. This is how kids are being raised this generation. Young girls are getting drunk, going out, and going to parties, and getting raped. They need to be more street smart. This is what happens when girls go out and get drunk. This girl, mind you, was sexually active with one partner, her boyfriend. Not that that is even relevant right now. Then he says to me, they should be taking their kids to church. And I am thrown so off guard. But I look at him and I go, no, I don't think that's the answer. And he says, yeah, because then they would be afraid that someone's watching them. And I said, that's what you believe. That is not what everybody believes. He gave an awkward laugh and walked out. I then went back in the patient's room and I told her, you are in a lot of pain. You are allowed to cry. Do not let anybody tell you that you cannot cry when you're in pain. She was so upset by the encounter that she just had. This is not the first time nor the last time that I have seen these types of encounters between patients and providers. And it is so sad to see. I don't care what your beliefs are, to be honest. Although I will say that sometimes I don't understand why people with such strong beliefs about certain topics go into certain fields. That being said, you can have a belief system that is so true to you that you believe so deeply in and not try to put that onto others. And at the end of the day, you're a physician. It is your job to treat all patients with respect, dignity, and empathy. I am so sick of witnessing these interactions. And I will never be the one to let something like this slide and not say something. And you better believe that that got reported. And people wonder why there's such a distrust of healthcare professionals. This is why.